Well, the KwaZulu-Natal Department of Health says the high number of new COVID-19 infections is due to the large number of people flocking to the province at the end of the year. KwaZulu-Natal is now the epicentre of South Africa's COVID-19 infections. Just over 5,000 cases were recorded in the province in the latest 24 hours. To discuss this and more, we're joined via Zoom by KwaZulu-Natal Health Head of Department, Dr. Sandile Tshabalala. Very good afternoon to you, Dr. Tshabalala. Thanks for joining us here on SA Today.
Good afternoon, ma'am, and good afternoon to the viewers.
Let's look at the province as we speak. KwaZulu-Natal continues to record a high number of infections. Talk to us about some of the safety measures that have been put in place for the festive season.
Thank you. Firstly, we're worried about the increase of the numbers of COVID-19. Remember, they are increasing at a time when also the numbers of trauma and violence cases are increasing. However, we continue to preach the non-pharmaceutical interventions in terms of the washing of hands, the use of masks, and all the other interventions that we've been preaching all over. But on top of that, we are now saying, with people being in the holiday mood, they must take care of themselves. They must make sure that as they take alcohol responsibly, and everything and every step that they do, they ensure that there is that element of responsibility. Other than that, we are dependent on the partnership between the department, not only the Department of Health, but the government of KwaZulu-Natal and the community itself, taking responsibility and accountability for all the actions they are taking.
Well, speaking of responsibility, are you concerned that infections might increase even more as more and more people flock to the province? And in the same breath, how are you going to ensure that COVID-19 compliance, especially in public places, are adhered to?
Look, we're expecting the increase to be coming from people who will be joining the province, coming back to their homes. Those will be coming from other places, but for purposes of holidaying. But also those that are in the province for not adhering to the non-pharmaceutical interventions. So all that we are doing is to ask the agencies that are there to ensure that there is compliance and adherence to the rules are going to assist us. But we must say that the leadership of the Premier and all the MECs in the province has been making us see numbers going up, but not as high as we had expected. I think if we were not in partnership and under the leadership that we are experiencing, our numbers could have been higher. We also are prepared in terms of the availability of resources. We don't want to use them because we think if people can behave better, the numbers are not going to increase as they are doing. And remember, it's before Christmas. Imagine between the 25th and the 1st of December, what is going to be the 1st of January, what is going to be the case in terms of our numbers. So we are really pleading with people to partner with us.
Well, speaking of resources and capacity, KZN Health MEC yesterday says that there has been COVID-19 cases even amongst healthcare workers. So I wonder, what are the plans in place to deal with the possible shortage of healthcare workers during this time, perhaps as we expect more, cases given the next few days?
I think we must first thank our healthcare workers who have always braved the COVID-19 pandemic and made sure that they continue to serve the people of our province, irrespective of what was happening. What we have been doing, one, we increased the number of healthcare workers by contracting other healthcare workers who would concentrate on COVID, but also assist in other things. At the same time, we are trying to ensure that our healthcare workers are vaccinated. Remember, we have seen increases in numbers of COVID-19 with the new variant, but we have not seen a lot of admissions because people are vaccinated. So we are encouraging our healthcare workers to vaccinate. We're encouraging them to also take care of themselves in terms of the non-pharmaceutical interventions. We have made sure that there is enough PPE for them to use so that they are protected as well. But the responsibility and the onus comes back to them in terms of reporting if there are gaps anywhere that we may have missed them. But we think so far things are not as bad, and the numbers are decreasing in terms of new healthcare workers that are being infected, but also where some healthcare workers have passed on, we are beefing up by employing more or new healthcare workers, and we must thank our cabinet in the province for allowing us to do that. So we think we are going to be disturbed because we are going to have patients being infected, staff being infected, and other illnesses that we have to take care of. But we are saying to our healthcare workers, while we thank them, they must take care of themselves as well.
Speaking of which, we're also then looking at the trends emerging in the province, and we've also seen that there's been a decline in the number of people willing to take the jab. Perhaps you could talk to us about some of the campaigns to first encourage people to take the vaccine, especially those perhaps between the ages of 12 and 17 and even 18 and 34. I mean, we do see that the department has in fact registered this as the lowest, this age group as the lowest rates of vaccination amongst, the youth as we're speaking.
Look, what we are doing on a continuous basis is to go on media, be it conventional or social media or any type of media, to engage the people to understand why is it that they are not coming forth to be vaccinated. What we find is that there are myths that have been created by different people. The issue of 5G, the issue of 666, the issue of people eating others after they have been infected, the issue of people dying, and we do tell them that no one has died after being infected, and all the other myths are myths. But also the advice from the Premier and the Cabinet has been that let us use our scientists more to engage with the community so that we counter the wrong science that is being put to the people who are doing all that. Beyond that, we are going to where people are. We have pop-up sites that we create even on the streets. We have pop-up sites that we create in the farm areas where the people living and working in the farms can be vaccinated for one reason or another. We go to the malls, and we also try as much as possible. We will be going to the beach as well. But we have a pop-up site there. Should people want to vaccinate, we vaccinate them. But also we are checking on people from time to time as they go to the different areas. So all these are strategies or operations that we are implementing to ensure that people of whatever age, we are not only concentrating on the age groups you are referring to, because some of the younger ones are convinced by the elders not to go and vaccinate. So we have to concentrate on all of them to convince them that the vaccine at the moment is the best thing that we can have, because this is a viral infection and there is no cure for any viral infection.
Dr. Sandile, I want to wrap up this conversation perhaps just by looking at, the strategies that you have employed, and you've spoken about, visiting different areas as well. I wonder, have you perhaps also engaged with traditional authorities at large to reach, people who are on the outskirts, perhaps where healthcare is also limited? What's the response been on that front?
Initially, when we started the vaccination program in particular, we found that the community that was not vaccinating much was the African Black community. And as such, we have then from long ago taken a stance that we need to engage with the traditional leaders, with the councillors, with the leaders in the different church groups, and all the other stakeholders that have influence. We've gone as far as having those that we call influencers in the form of celebrities and leaders in the different communities, for them to understand the vaccine and the advantages thereof, and therefore them to go and influence other people to go and vaccinate. But what we are asking for from all the groupings, be they traditional leaders, traditional healers, civil society, NGOs, religious organizations and all the stakeholders that are within our province. We are saying, let us work together and listen to the correct science, and therefore make sure that the people of our country are safe. And on top of that, we want to prevent further lockdowns, because we've seen gender-based violence that came with that lockdown. And we are also saying, as we go into the holidays, let us also drink responsibly, because sometimes after drinking alcohol to a certain level, you do not adhere to the non-pharmaceutical interventions, and that creates problems for us.
Dr. Sandile, thank you for your time. Let's leave the conversation there. Again, KwaZulu-Natal Health Head of Department, Dr. Sandile Tshabalala.